Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive.
Smooth 98.1, love music, love life. Welcome back. If you just joined us, you are just in time. Well, you're just in time for Smooth Health. And of course, I've got a very, very, very special guest in the studio today. We're going to be talking about something very interesting. I mean, I had a bit of a tongue twister when I wanted to pronounce it at the start of our show, behind the scenes, having a conversation here. But before we dive right into it, I'd like to let you know that we're giving out vouchers worth 30,000 naira, 10,000 naira each to 3 people. Okay, so if you want to be a part of our conversation, you have to call the studio lines. So I'm giving it to the first 3 people that call the studio. Okay, number to call is 0144899981. I'll say that again, 0144899981. In the studio today, I have Dr. Arua Igwe Obasi. He's a pediatric surgeon. And also, we are going to be talking about undescended testis. That's what we're talking about on the show today. Now, Dr. Igwe Obasi is a consultant pediatric and minimal access surgeon focusing on pediatric minimal access surgery. And of course, he has significant experience in all that I've mentioned, basically. And he's here to give us all the details out there. So if you've got more questions for him, feel free to look at the phone lines buzzing already. If you've got questions for us, please, call the studio lines like I mentioned. Hello, sir. Good to have you here.
Thank you so much.
Let's just dive right into it. I'd like to know this, though. Who is a pediatric surgeon and what is the unique role that, a pediatric surgeon, what roles do you play?
Okay, thank you so much. A pediatric surgeon is a medical doctor that is specialized in treating children that needs surgical intervention. That's a summary. So the role we play is perform surgeries, make diagnosis of surgical conditions in children, and perform the surgical intervention that they need to recover from their illness.
Okay, well, sounds like a very, very, very important job. Okay, away from that though, let's talk about the process of pediatric surgery, particularly at Evercare. And, I'd also like to know what are some of the pediatric surgical treatments that Evercare Hospital provides.
Okay, so at Evercare Hospital, any patient within the age of 0 to 16 years of age can actually walk into our facility and get a pediatric surgical service if they need surgery.
Okay.
So, and they can come in as referrals from any other hospital or self-referral or walk-in patients, maybe someone that had a trauma or someone that has any illness that needs surgery. So, and we cover a wide range of conditions, including congenital anomalies, that is problems that children are born with from the womb.
Okay.
So they also...
Sorry, could you highlight some of those problems? Because you say problems that children are born with from the womb. Some people might have those problems and not even know.
Exactly.
So can you highlight some of them so we can, for the people out there?
So some of those conditions will include undescended testis, like we're going to talk about today.
Okay.
And they also include things like intestinal problems, intestinal blockages, that we call atrasias, esophageal blockages, like esophageal atrasias, even so many other abdominal conditions that can arise.
Okay. All right. Like I mentioned, to be a part of the conversation, please call the number 0144899981. I'll take the first call and see who this is. Hello. Good afternoon.
Yeah, good afternoon.
Hi, good afternoon. How are you doing today?
I'm fine. My name is Rotimi.
Hi, Rotimi. Where are you calling from?
Yeah, I'm calling from Inteja.
Okay. So do you have a question for our doctor today?
Yes. I have a 8-year-old daughter that is...
Rotimi, hold on. Can you say that again, please?
Okay. I said I have 8-year-old daughter that is having adenoid issue. Are you there?
Yes, we're here. Go on.
So I wanted to make inquiry on, although we've gone to hospital and then we got little advice from the doctor that it will outgrown it, but I'm much concerned because the year they said it will outgrown, like 8 years, it's almost 8 years, and then he's still experienced. When he's sleeping, she's snoring hard, and then they used to give us some drugs that we used to give her, but we are thinking of maybe we should operate her, and I just wanted to get little advice from the doctor.
All right, Rotimi, thank you so much for that one. And also, please text us your WhatsApp number so that we can give you the voucher, because you are the first person to call, and we're giving out 3 vouchers on the show today. But thanks for sharing.
It's all right.
All right, thank you so much.
Yeah.
Okay, thank you, Rotimi. Just a quick answer for your question. A child that has adenoid swellings, it can actually cause some obstruction in the nasal airway and make the child to snore.
Okay.
Now, sometimes it can be treated with antibiotics, and if it persists, surgery may be needed. So to make that decision, we may need to see you in the clinic and then review and tell you what the next step should be.
All right. That said, let's quickly take the next call, and before we dive into the main topic for the day. Hello. Good afternoon.
Hello. Good afternoon.
How are you doing today? What's your name?
My name is Anna. I'm calling from Lekki.
Okay, Anna from Lekki. Do you have a question for our doctor?
Yes, I have 2 actually. First off, how affordable are the surgeries? Any surgery in particular?
Okay. And what else is the other question?
Okay, the other question is, so my baby sister has been, her breathing is not good. If we're looking for her, you just need to keep quiet and you hear the breathing. But we just always feel like it's nothing and she's too young.
Can you repeat that again? Oh, wow. I think we lost you. We lost that call. Please call back if you can, okay? Anna? 014489981. Okay, so you are the second caller, by the way. Also, please send a WhatsApp message so we can have your number at the same time. A final caller before we dive into our main topic, which... Hello, good evening.
Hello, good evening.
Hi, good evening.
My name is Innocent.
Hi, could you turn down the volume of your radio, please?
Come on, turn down the Java, turn down the
Hello?
Java, turn down the Yeah. Can hear you now.
Okay, go on. What's your name?
Yeah, my name is Innocent Moses.
Okay, Moses, go on.
Yeah, I have an 8-year-old girl, and she coughed too much, and we've been using some syrups, and it's just as if it's getting too much.
Okay.
You know? So I want to ask the doctor that what may be the final solution for that girl to stop that kind of high cough like that.
All right, thank you so much, Moses. By the way, don't forget, Moses, please send us your WhatsApp number. Send it to our WhatsApp number. I'm going to read out the number to you because you are the third caller and you also win a voucher on the show today. Okay?
All right, thank you.
All right, doctor.
Okay, thank you, Moses, for the question. Because of the cough, there are up to 1,000 things that can actually cause cough. So it will be important for our pediatrician to actually see your daughter and do certain investigations and make the right diagnosis before we start treatment. One of the things that makes cough to persist is when people are treating something that is not the particular problem. So until we make the right diagnosis, so we can pinpoint the problem and give appropriate treatment. So thank you.
All right, that said though, let's get back to the major topic for today. We're talking about undescended testis, right? So it's not a condition or a lot of people are aware of, but it's a condition doctors find to be common among newborn males. Okay, so the question here is this: what is undescended testis and how can it be identified?
Yeah, thank you so much. Undescended testis simply means that the testis has not gotten to the scrotum. Naturally, the testis is created in the abdomen and it descends to the scrotum at about the 9th month of pregnancy. So when the testis is not in the scrotum, it can be in the tummy, in the abdomen of the child, or it can be anywhere along the line of normal descent, which is maybe in the groin or on the upper part of the scrotum. So as long as it's not in the scrotum itself, it is called undescended testis.
Okay. All right. And how can, like you mentioned, how can it be identified? Okay.
So one of the issues is that most people don't usually identify this because they don't usually look for it. But thanks to our mothers who are always bathing our children, and they want to be careful when they look at it, they say, this scrotum is not, this testis is not in the right place.
Okay.
If it is not in the scrotum, in the floor of the scrotum, it is undescended. So when you have a child, so you look at their testicles, both sides.
Okay.
So you want to be sure that they are on the floor of the scrotum, they are down. If it is in the groin, it is wrong. If you cannot feel it at all, then it is wrong. Then you need to see a doctor.
All right, thank you very much for that. Let's talk about how it can be diagnosed at the pre-birth stage, and also what are some of the risk factors that pregnant women should know about.
Okay, just as a recap, undescended testis is actually very common. It's about 3% of all newborn fully term babies have undescended testis. That means if you count 100 children that are born today, 3 of them will have undescended testis.
Okay.
So, but about as they grow up to like 1 year, some of those testes tend to come down. So about 1% will now continue with undescended testis. So now, what causes it is not really well known. It's a mixture of several conditions, especially, but the most important is hormonal imbalance with the mother.
Okay.
So testis descent is done actually by hormones.
I like the fact that you said hormonal imbalance.
Yeah.
So let's take a step backward. For women out there, what causes hormonal imbalance and how can it be identified? How can it be stopped?
Okay, so if a woman is taking certain hormones to induce, or maybe they have been on contraception or certain other things that may change their hormonal status, or maybe there is a tumor somewhere that is producing abnormal hormones.
Okay.
So that can change the level of testosterone in the child. Testosterone is responsible for descent of the testis most of the time. So now, apart from hormonal imbalance, there are several other conditions that can actually predispose this child to having undescended testis, and this will include other congenital anomalies. For example, somebody that has what we call abnormality of the urethra, like the pipe that takes the urine from the bladder to the exterior. So if there's abnormality of that urethra, it also have a higher chance of having undescended testis.
All right.
Then children that are born premature, about 33% of them to almost 50% of them have undescended testis. These are risk factors. So when a child is born premature, it simply means that the course of descent has not completed.
Okay.
So when they are born, you will see most of them to have undescended testis also. So these are the common predisposing factors.
All right, if you're out there and you want to be a part of our conversation, don't forget Smooth Health is what you're listening to, and you can reach out to us up on our WhatsApp platform 0809-444-0981, or you can call the studio lines 0144-89981 to be a part of our conversation. Dr. Arua Igwe Obasi, he's a pediatric surgeon. He's our very special guest on the show today. We'll go on a very quick break. When we get back, we'll do some more talking. This is Smooth 98.1.
Smooth Health on the Drive.
So Lagos, if you didn't know, now you know.
Stay tuned. This is Smooth Health on the Drive.
It's a global observation that helps raise people's
Smooth
awareness.
Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
Smooth 98.1. Love music, love life. It's still Smooth Health. It's powered by Evercare. And if you're out there and you want to be a part of our conversation, don't forget, like I mentioned, call 0144899981. Dr. Arua Igwe Obasi. He's a pediatric surgeon. He's our very special guest today. And of course, he's taken us through our topic today. We're talking about undescended testis. So far, we've identified what it is and, the causes and also how to treat it, right? I'd like to ask this, though. Are there other health impacts for children with undescended testis during their adult life?
Yes, exactly. Why we really want to discuss this is because of the lack of knowledge of the community concerning this particular condition. If a child has undescended testis, the testis simply means that it is not in the right location, which is the scrotum. And the way it was created is meant to stay separate from other structures in the body so that the temperature control will be different from that of the body. So it has a lower temperature in which it functions optimally. So if this testis is anywhere else aside from the scrotum, the changes in temperature will not allow optimal functionality of that scrotum. And it will also not allow the testis to develop appropriately. So it will predispose the testis to not able to produce spermatozoa, which is important in reproduction.
Yeah.
So it will also make it prone to different kinds of changes, which is malignant, what we call malignant transformation. That's cancer. So there is increased chances of cancer of the testis and increased chances that testis will not produce.
At what age, though? When you say increased chances of cancer, so is there like an age that this could occur, or it could happen at any point in time?
Yeah, the age is not cast in stone.
Okay.
As long as it is not in the right position, so it can transform. It can continue to transform into malignant tissue.
Okay.
So that can happen maybe 20 years, 30 years from the time, or even up to 50 years. So, but that is a small percentage of those patients can have cancer from that. It just increases the chances that they can have cancer from that testis.
All right. Thank you very much for that. Let's see who this caller is. Hello. Good evening.
Hello, good evening.
Hi, good evening, sir.
Good evening. I've been trying to call you since the program started.
Okay. Welcome to the show. What's your name?
My name is Ado.
Ado?
Yes.
Okay, please go on.
I have a 6-year-old boy, and I noticed when I bathe him with cold water, because the water makes him cringe. On top of his, where the pubic hair should go, tends to swell so much. Initially, I thought it was hernia when he was growing up, but it stopped at the time. But I noticed now that I bathe him with cold water, because it cringes, it makes that, I don't know, someone said the testis goes down towards the sac there and makes it swell, that he might be needing operation or whatever. I'm just kind of confused, but it happens only when I bathe him with cold water. So I don't know if there's any science to that, or it's normal. I don't think it's normal, but things happen. I have other boys that doesn't happen to them, but I'm really worried. So I decided to call him when I heard the subject matter being, discussed. Thank you.
All right.
Okay, thank you, Mr. Ado. When you bathe with cold water, so the body wants to warm the testis, so it will take the testis towards the abdomen. So it's what we call the cremasteric reflex. It's a reflex. So the scrotum contracts to push the testis towards the abdomen, which is warmer. So, but it's not supposed to swell up. It's just supposed to go up and go down. So if it swells and there's a significant swelling, then you need to see us so that we can find out exactly what is swelling. It can be a hernia. It can also be that the testis is undescended. So we have to actually make the right diagnosis and then give you a better advice. So it's something that the doctor needs to see actually. It's not supposed to swell, but usually when there's a cold environment, the scrotum tends to contract and it pushes the testis towards the abdomen and makes it to get warmer before it releases again.
Thank you very much for that. Which leads me to my next question. So how does Evercare manage issues of undescended testes in newborn babies?
Okay, so when a baby is born with undescended testis, so like I said initially, most of them will resolve within 6 months to 1 year of life. So initially, we have to find out where actually is this testis. If the testis is maybe in the groin or maybe in the upper part of the scrotum, then most of the time they can resolve. They can come down within the first 6 months to 1 year of life. But if the testis is inside the abdomen, then it's likely not to come down most of the time. So, but we have to watch this child for at least 6 months or more than that to wait for it to descend. If it doesn't descend, then we need surgical intervention. And to treat this condition, it depends on where the testis is found. If the testis is in the groin, so we can bring down the testis directly surgically into the scrotum. If it's in the abdomen, then we have to go inside the abdomen to bring down the testis, and that can be done using minimal access surgery like we do in Evercare. So if this testis is not brought down after the age of 1, then there will be progressive degeneration of that testis, progressive transformation of that testis, making it unable to function normally as far as reproduction is concerned. However, it continues to function as per hormone production. So it will, of course, the boy will have hormonal changes like a normal boy, but the ability for that testis to produce spermatozoa will reduce progressively. So that is why it needs to be treated on time.
This one's a message from Cisco Delgado. He says, "Good evening, Dr. Obasi. Can someone overgrow undescended testis as he grows older?"
So, if I get your question correctly, overgrowing it, to me, it simply means that before the age of 1 year, the testis should have descended to the normal location. If it does not descend after the age of 1 year, it cannot be overgrown. It has to be brought down by surgery.
And that can be done at any age?
Well, it can be done at any age, but when somebody is maybe start getting to puberty, it is noted that the chances of that particular testis having any reproductive function is completely lost. So there is no need leaving that testis behind, because it's just there as a risk for malignant transformation. It becomes a risk. So most of the time, once the person is up to the age of puberty, you just want to take out the testis.
All right. 0809-444-0981. That's the number to call to be a part of our conversation. Smooth Health is what you're listening to. It's powered by Evercare. And so we've got Dr. Obasi still in the studio with us, Dr. Arua Igwe Obasi. He's a pediatric surgeon. And of course, he's taking us through undescended testis. So if you've got questions for him while he's still here, please send them in. I'd like to ask this though. How long does it take an undescended testis to get back to its normal position after treatment? Also, are there conditions in a child that determines that?
Okay, so how long is when you do the surgery, and depending on the location of the testis and the situation you find the testis. So sometimes if the testis is not descended, that testis is prone to so many problems, including just spontaneously dying off. So sometimes because the testis is not located properly, the blood supply to that testis is blocked for whatever reason inside the abdomen, and then it will just gradually die off. But if the testis is present and it is in the body, it can be brought down to the scrotum at the time of surgery. However, this can be done in stages depending on the severity. If the testis, the blood supply is too short,
yes,
and it cannot follow the testis down to the scrotum, so we can do it in stages to look for new blood supply for that testis. So you bring it down in stages. So that will take like 6 months for you to bring it down. That's in a very severe case. But in straightforward cases, on the day of surgery, just go in and take it down, and the testis will function normally.
All right. Thank you very much for that. Real quick, though, let's talk about, advice for pregnant women, nursing mothers, and also, advice to generally reduce the risk of having children with such conditions.
Okay, so for mothers intending to get pregnant, especially those on hormonal drugs, hormone-changing drugs and all that.
Sorry, before you go further, what are hormone-changing drugs? Because, some people might be taking these drugs and not even know that they're taking them.
Basically contraceptives.
Okay.
Contraceptives. So these things can alter the hormone of the mother. And if there is any other medical condition that requires some of those drugs.
Yeah.
So they can alter the mother's physiology. So these are just preventive, like things that may cause. Most undescended testes, we don't really know the cause. So the patient is normal, the mother is normal, pregnancy went well, and
it just happened.
You just have a child that has undescended testes.
Let me circle back to what you said about contraceptives, though. So, how about for women that are not pregnant, maybe unmarried women that had been taking them prior to marriage and pregnancy? Would that have an effect in the coming years? Could that have an effect in the coming years?
Not exactly. Before a woman gets pregnant, he needs to stop the contraception for a period of time.
Okay.
So that will give time for the normal cycle to start again.
Okay.
So when the normal cycle starts again, then the chances of having any abnormality reduces.
Okay.
So if you are taking contraceptives and your hormone changes and then you want to get pregnant, it is advised to stop that contraception, and there's a period of time that you need before your normal cycle commences, and then you can get pregnant.
All right. Choma sends a message in. She says, hello, doctor. What do you mean when you say where the testis is found? Is there a particular place it stays in the belly when not descended, or it flows about? Okay.
Thank you, Choma, for that question. The testis comes from the abdomen. Remember, the females have their ovaries in the abdomen. So when we were developing in the womb, all our gonads, what we call gonads, that is what forms testis and ovary, are in the abdomen. So for the boys, because of testosterone, it starts going down and goes down until it gets to the scrotum. So there is a particular route that it takes to get down to that scrotum. So if for whatever reason the testis is arrested along that route, it is called undescended. So it can be arrested within the abdomen, within the tummy, or it can be arrested within the groin, or it can be arrested just high up in the scrotum. So anywhere can be undescended. So for instance, if it's in the abdomen, so there's a longer distance we need to cover to bring it down to the scrotum.
Okay.
So the blood supply, which is very important to that testis, will be very short. So you still need to bring it down. That means you need a new blood supply for that testis when you bring it down to the scrotum, because it's difficult to take that same blood supply down to the scrotum.
All right, thank you very much for that. Okay, so if you just joined us, well, this is Smooth Health, and Dr. Arua Igwe Obasi has been, is the guest generally. We're talking all about undescended testis. If you're wondering, his specification, he's a pediatric surgeon, and his areas of interest are laparoscopic and thoracoscopic surgeries in children. Is it? Yes?
Laparoscopic and thoracoscopic surgery.
Yes, and fetal surgery. Fetal surgery, pediatric surgical oncology, and congenital malformations as well. Okay, so for the good people of Lagos listening to you, though, how can they reach out to Evercare Hospital?
So, thank you so much. To reach out to us, so we are located at number 1 Admiralty Way, Bisola, Durosimi 80 Drive in Lekki, Phase 1. So, and you can call us on 081 398 50710. I will repeat the number, 081 398 50710. Then you can send us email at info@evercare.ng.
All right. Thank you so much, Doctor. Pleasure having you here, and look forward to seeing you again real soon.
Thank you so much.
Lagos, there is more to come. In a few more minutes, we'll be serving you with some other, great programs lined out just for you. But please stay close to your radio. This is Smooth 98.1. Smooth Health is what you listen to.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.